We're not supporting Dr. Brzezinski's work, although I would encourage him and hope that he would make some progress in that area, but primarily we don't support that work primarily because you're too dependent upon this injection and there's no backup of the metabolic process. You've got to restore the body simultaneously with whatever you're doing. We know, and you'll hear speakers from this platform, that people have been able to recover from cancer and are enjoying that long-term recovery because they have done a rebuilding job of the body without any additional adjunctive help. But if you take the adjunctives and you don't repair the body, you're not going to be that much better off than if you take a method put out by the medical community that destroys the cancer and neglects the patient. This is why we feel all the recurrences occur, is because they're killing cancer cells and unfortunately not healing the patient. And we don't like to see cancer cells killed with any harmful material. We're not telling anyone not to take chemotherapy, not to take radiation, not to listen to their doctor. What we're spelling out for you here is the concept behind the organization, why it came into existence and why it still exists. It's to do no harm to the body of the patient, to use every device possible to start the rebuilding process. And we think the medical community is going in that direction. That does not mean that the doctors, when I say the medical community, it's primarily the research area at this time, not so much in your doctor's office. But we would hope in not too long a time that it will become the standard protocol, possibly to do a surgical removal of a tumor, to debulk the tumor, because people have had surgery done and it has not interfered with their full life expectancy. But to follow up that surgical procedure with the repair process. You're going to hear some metabolic physicians here, you're going to hear cancer patients, hope that their stories will leave an indelible amount of information with you that you're going to carry with you forever and send on to other people. Another therapy that I want to talk about is, when I'm up here and I know so many people and I see them come into the room, I have a tendency to look around and feel as though I want to say hello, which is a little ridiculous, of course, but I suffer from problems. Try a diet? Good idea. There was one other therapy I wanted to talk about. It'll come to me. It's all right. Hydrazine sulfate. This was touted by many people and amateurs who were on writing books or talking to the practitioner himself, and he's only going to give his point of view. It's not going to be unbiased. Not that he means to be biased, but it's just a normal process for the individual who's providing a therapy to give a biased point of view. Now, the hydrazine sulfate was touted quite some time ago because it was so inexpensive. You could practically do it yourself. And the idea behind it was that it would block sugar metabolism at the liver site. And it did do that. And why they wanted to block sugar metabolism at the liver site was because the cancer cells, it seems, or this is what I hear, tend to take up that sugar and survive on the sugar. So, of course, if you block the sugar production, you might be able to reduce the cancer problem. But you can destroy cancer cells with radiation, you can destroy it with chemotherapy, and if you destroy it with this system, are you any further ahead than the others when you're using a chemical that's blocking the glucose from the healthy cells? That's exactly what chemotherapies do. They block the ability of the healthy cells to take up material that it requires. Actually, they mean only to block it from the cancer cells, but it also blocks it from the healthy cells. And we're repeating over and over again here. We want the body to have all of the material it requires, all that nature intended it to have, so that it is going to recover.